Few things are more frustrating than a fussy, gassy baby. Those tiny bundles of joy can turn into screaming sirens thanks to trapped air bubbles causing discomfort and distress. But fear not, dear parents. Mastering the art of burping can be your secret weapon in the battle against gas and irritability. This comprehensive guide will give you the knowledge and techniques to burp your baby effectively, whether awake, asleep, or determined to hold on to their air bubbles with ninja-like stealth. Why burp a baby? Babies tend to swallow air when they suck on a bottle or a breast, especially if they are hungry, eat fast, or have a poor latch. This air can accumulate in their stomach or intestines and cause them to feel full, uncomfortable, or fussy. Unlike adults, babies have underdeveloped esophageal sphincter muscles, meaning they cannot burp independently. Without assistance, trapped gas can accumulate in their digestive system, causing discomfort and pain. Hence, as caregivers, it's our responsibility to help them release this gas through burping. Burping can help the baby expel the excess air and make them feel more relaxed and satisfied. Burping can also reduce the risk of spitting up or vomiting, which can happen if the baby has too much air or food in their stomach. However, burping is not essential for every baby or every feeding. Some babies may not swallow much air or may burp on their own without needing any help from their parents. Some babies may also prefer to sleep after eating and may not appreciate being disturbed by burping. Therefore, parents should follow their baby's cues and preferences and burp them only if they need or want it. How to burp a baby. There are different ways to burp a baby, depending on whether they are asleep or awake and what position they are comfortable in. The general principle is to hold the baby slightly upright and gently pat or rub their back until they burp. Some common methods include on the shoulder. Hold the baby upright against your chest, with their chin resting on your shoulder. Support their head and neck with one hand, and pat or rub their back with the other hand. You can also gently rock or bounce the baby to help the air move up. This method works well for both babies who are asleep and those who are awake, as it is cozy and soothing for them. However, you may want to place a cloth or a bib on your shoulder in case the baby spits up. On the lap, lay the baby face down on your lap, with their head slightly higher than their chest. Support their head and neck with one hand and pat or rub their back with the other hand. You can also gently move their legs or hips to help the air move up. This method works well for babies who are awake, as it puts more pressure on their stomachs. However, it may not be comfortable for babies who are asleep, as it may wake them up or make them cry. Sitting up. Help the baby sit up on your lap, with their head and chest leaning slightly forward. Support their head and neck with one hand, and pat or rub their back with the other hand. You can also gently move their body from side to side to help the air move up. This method works well for babies who are already awake. However, it may not be suitable for babies who do not have good head control or who are already asleep. No matter your method, you should gently and patiently burp the baby and avoid hitting or shaking them too hard. You should also burp the baby in a quiet and calm environment and avoid loud noises or bright lights that may disturb them. Techniques for comfortable digestion. Burping a baby is essential to caring for their well-being, especially considering how it can prevent uncomfortable tummy aches caused by trapped gas. Knowing how to burp and release trapped gas correctly can make a significant difference in their comfort, whether your baby is awake or asleep. If, despite using the methods above, your baby doesn't burp, don't worry. It's common for some babies not to burp during every feeding session. In such cases, trapped gas may enter their digestive system, causing discomfort. To alleviate this, a gentle baby massage treatment can be highly effective. However, waiting at least 45 to 60 minutes after feeding is essential before administering a massage. This allows time for digestion and prevents any discomfort that may arise from massaging a full stomach. The massage treatment involves several steps, including stroking around the baby's belly button in a clockwise direction to stimulate the colon, stimulating acupressure points linked to digestion, and gently bending the baby's knees to release gas. Consistency is key when performing the massage treatment, especially if your baby experiences persistent gas issues. Increasing the duration of circular movements on the baby's belly, And repeating the massage up to 6 times a day in severe cases can help alleviate discomfort. Knowing how to burp a baby correctly and release trapped gas is essential for their comfort and well-being. By utilizing various burping positions and incorporating gentle massage techniques, caregivers can effectively alleviate gas-related discomfort in babies, ensuring a happier and healthier experience for both baby and caregiver. When to burp a baby. There is no fixed rule on when to burp a baby, as different babies may have different needs and preferences. However, some general guidelines include: burp the baby during or after each feeding, depending on how they eat and how they feel. If the baby eats fast, has a poor latch, or seems uncomfortable, you may want to burp them more often, such as after every few minutes or ounces of milk. If the baby eats slowly, has a good latch, or seems relaxed, you may want to burp them less often, such as at the end of the feeding or not at all. Burp the baby before switching sides or bottles to make room for more milk and prevent overfeeding. This can also help the baby get more of the hind milk, which is the richer and fattier milk that comes at the end of the feeding and can help them grow and gain weight. Burp the baby before putting them down to sleep to prevent them from waking up with gas or spitting up. However, if the baby is already asleep, you may not need to burp them unless they seem restless or uncomfortable. You can also try to burp them gently without waking them up, using the shoulder or swaddle methods. How long to burp a baby? There is no fixed time on how long to burp a baby, as different babies may burp faster or slower than others. However, you should burp the baby for a few minutes or until they burp, whichever comes first. If the baby doesn't burp after a few minutes, you can try changing positions or moving on to the next feeding or activity. Some babies may not need to burp at all, or may burp later on their own. Burp the baby until they seem relaxed and satisfied or until they fall asleep. If the baby seems fussy or uncomfortable, you can try burping them longer or soothing them in other ways, such as cuddling, rocking, or singing. Depending on their temperament or mood, some babies may need more burping or soothing than others. Burp the baby until they spit up if they tend to do so. Some babies may spit up a small amount of milk or air, which is normal and harmless as long as they are gaining weight and not in pain. However, if the baby spits up a large amount of milk or blood or seems sick or in pain, you should consult your doctor, as it may be a sign of a more serious problem such as reflux, allergy, or infection. The key to successful burping is finding what works best for your little one. Experiment with different techniques, observe their responses, and be patient. What to do if the baby doesn't burp or has trapped gas? Some babies may not burp easily or at all, or may have trapped gas that does not come out with burping. This may be due to their anatomy, physiology, or personality, and it is not necessarily a problem as long as they are healthy and happy. However, if the baby seems uncomfortable or in pain, or if the gas interferes with their feeding or sleeping, you may want to try some of the following tips to help them release the gas. Change positions. Sometimes a simple shift can help the gas move up or down. You can try holding the baby in a different position, such as upright, sideways, or upside down. You can also try laying the baby on their back and gently lifting their legs up and down, or moving them in a bicycle motion. You can also try laying the baby on their tummy and gently massaging their back or belly. Apply gentle pressure. Sometimes a light touch can help the gas escape. You can try pressing your hand or a warm cloth against the baby's belly, or placing the baby on a firm surface, such as a crib or a floor mat. You can also try using a gas relief device, such as a windy or a Q-tip, that gently inserts into the baby's anus and allows the gas to come out. However, you should use these devices with caution and only with the doctor's approval, as they may cause irritation or injury to the baby's delicate skin or tissues. Try natural remedies. Sometimes, home remedies or alternative therapies can help the gas go away. You can try giving the baby some herbal teas, such as chamomile, fennel, or ginger, that can soothe the digestive system and relax the muscles. You can also try using some essential oils, such as lavender, peppermint, or lemon, that can stimulate circulation and release the gas. However, you should use these remedies with caution and only with the doctor's advice, as they may have side effects or interactions with the baby's medication or allergies. Conclusion: mastering the art of burping can be a game changer in your parenthood journey. With the right techniques, patience, and understanding, you can help your baby and yourself navigate the sometimes gassy world of early infancy. So remember, burping isn't just a chore. It's a pathway to a happier, more comfortable baby and a calmer, more confident parent. These tips can help you avoid the common problems and complications that may arise from gas in the baby and ensure the comfort and well-being of the baby.